Here's my audience and here's my speech. Alarming, right? If you wash your hands like and they bled like this, you would be alarmed. So often when people brush their teeth and their gums bleed, they're not. My name is Amanda Harden and I've been a dental assistant for 5 years. And I'm here today to talk to you about periodontal disease, how it's directly linked to heart disease, and what you can do to prevent it. The information I have for you is backed by the ADA, WebMD, and Dental IQ. So I'm going to start by talking to you about periodontal disease. And it starts out as gingivitis, which is an inflammation of your gums after plaque and tartar have sat there too long. It causes inflammation. Gingivitis can be reversed if taken care of properly, so it's good that you get it diagnosed early. Once it becomes periodontal disease, the gums are separating from the teeth and bone tissues, causing pockets, and that's when you start to have problems with losing your teeth. And the warning signs of that are bad breath, red inflamed gums, and the pockets. Okay, so now that we've talked about periodontal disease, we're going to go ahead and talk about how they are directly linked to heart disease. Both are inflammatory processes. So we already know that gingivitis is inflammation of the gums. Also, heart disease is inflammation. And it gets from the gums to the heart via plaque. And that is when you're brushing your teeth, it gets in through the blood, essentially. So, it goes through the blood, through the circulatory system, and it ends up creating plaque in your arteries. Okay, and then how it gets there obviously is, the circulatory system. So we want to prevent that by making sure to brush twice a day, floss twice a day, and make sure that you get your preventative care as well. That gets set up by the dentist. Some people need 3-month checkups. Some people need 6-month checkups. But you want to make sure that you're getting them to check for, x-rays and decay and your periodontal disease for sure. Yep, and that was my speech. Thank you. My audience again is right here.